Hi, everyone. I'm Gretchen Bailey. I am Editor-in-Chief of Optometry Times, and I am joined today by Dr. Ed Bennett. Dr. Bennett is Executive Director and President of the GP Lens Institute. In addition, he is Professor Emeritus at the University of Missouri St. Louis College of Optometry. Ed, thanks so much for talking with me today.
Well, thanks for having me today, Gretchen. I'm excited to be part of it.
Sure. Well, I wanted to talk to you a bit about contact lens safety because I know during this novel coronavirus pandemic, there has been some misinformation out there about the safety of contact lens wear, both on the part of doctors, contact lens fitters, and patients. And people aren't really understanding what's safe and what isn't. So can we talk for a minute about what is being done by optometry to address contact lens safety during COVID-19?
Well, I'd love to talk about it, Gretchen. You hit the key word, misinformation. I think there's a lot of knowledge out on the press that's gotten to the consumer that perhaps contact lenses shouldn't be worn while COVID-19 pandemic is going on. And the fact remains that there's no evidence to associate contact lens wear or contact lens wear causing COVID-19. And that was even supported by the Centers for Disease Control this week. So we know that contact lenses are safe. We always recommend, as we had in the past, that if you're wearing disposable lenses, daily disposables, throw them away as soon as you wear them, as soon as you get done wearing them. If you're wearing 2 weekly, monthly, longer replacement lenses, to always clean and disinfect them as recommended by your eye care professional. Throw your cases away every week. Most important, and I know you've never heard this yet, wash your hands thoroughly prior to inserting and removing. Whether it's COVID-19 or any type of problem or illness, don't wear your lenses. And then, in fact, they're safe. And there's many excellent sources out there that our eye care professionals can use to be able to educate their patients. The GP Lens Institute has a document that's right on the website, gpli.info, on what you need to know in COVID-19 and contact lens wear, as well as an insert that CLMA member labs are going to send to patients if they're direct shipping a GP lens to the patient, tells them how to care for them, but also that this may well be a one-time or special circumstance. And for them, once the doors open again for routine patient care, their eye care professional to get scheduled for an exam. Tom Quinn, everybody loves Tom Quinn. He has an outstanding YouTube video on contact lens safety that people can access. And the Academy of Optometry and AOA, their respective cornea and contact lens sections, have developed a document. So there's great sources out there that you can put on social media, put on your website, email your patients to really confirm that contact lens wear is safe.
That's really great to hear. I'm glad that there are that many resources out there for doctors to access because there just is a lot of misinformation and people are confused. So I'm really glad to hear that optometry is stepping up to the plate like that. And we will be sure to include links to these resources. But you were mentioning about communicating with patients. How can ODs communicate with, provide lens care to, and retain their contact lens patients during this time of uncertainty?
I know that's exactly the question that everybody's had to face. And I'm sure a lot of the practitioners have already found their way of being able to do so. I've lived it. My wife is partners in an optometric practice. She's been, and her partner, been on the phones every morning, every day. And that's just it, direct communication. It's all about communicating with patients. This can actually be an opportunity for eye care professionals, because if the patients receive phone calls from you, the respect they're going to have for you and the retention that'll result from that will be wonderful. So it begins with identifying those patients, certainly answering all the calls that come in or having someone answer them. It could be outside vendor wanting prescriptions renewed, and we don't want to not be there for that. And also our communication with patients minimizes the impact that outside vendors have to begin with, but also being proactive, identifying whether through your software, as I'm sure many practitioners have done, or the house, identifying those patients who are about due for new contact lenses or will be due soon, and contact them. And every lab and every company will direct ship. So you've got that opportunity presented to you. And actually, we held a forum last week with 20 of the, I think, most renowned contact lens specialists in the country. And really, almost to a person, they were proactive in communicating with these individuals, either, again, identifying through their software, whatever ways they communicated with them. And actually, office revenue, which, by the way, contact lenses are your primary mode of office revenue during this pandemic,
right,
really has been fairly good. So it really begins with communication and being able to identify those individuals, contact them, and then I think in terms of being able to survive this pandemic, that's huge.
I absolutely agree. Absolutely. So let's switch gears for a moment, because you were talking a few minutes ago about contact lens wear, and you mentioned about daily disposable or 2-week or monthly. What about gas permeable contact lenses? Do gas permeable contact lenses continue to be safe for patients to wear during COVID-19?
Well, I'm glad you asked me that, Gretchen. I think GP lenses continue to be safe. One of the areas, for the same reasons, that if they're cared for properly, they've always been the safest form of contact lens wear, along with, I'm sure, daily disposables. So they're, if they're cared for properly, they are certainly safe. One of the, I don't know what the
Well, I think we froze here for a second, Ed. Are you there?
term of the challenges maybe that have to be, yes. Yeah. One of the challenges that we find ourselves today is that we will allow labs to direct ship a GP lens, and it could be a scleral. Like, certainly we know with GP lenses, a lot of our patients need to wear their lenses.
Right.
And that's why this scare that's been going on is so alarming, is because we know they're safe, and we know they need their lenses, but we do have to direct ship, and when we do, we can certainly be able to help the patient out. I think the labs are very willing to do that. But also, just an FYI to all practitioners, some of the packages come back to the post office or UPS or wherever they go to, they as undeliverable, because there's just nobody in the office or no way of really being able to. So it's important for all eye care practices to at least have information to let them know where to deliver if there's nobody there.
That's a good point.
If that's done, then I think everything's fine.
Excellent. Thank you. That's great information. So when we're talking about labs direct shipping, I know you mentioned also that labs are putting some information into the packages for patients. How can contact lens laboratories help contact lens fitters with caring for their specialty contact lens patients during this time?
The interesting thing that we tend to forget is obviously everybody's impacted by this. And that includes all your independent contact lens laboratories. And in talking to several of them this week, it's evident they're greatly impacted, like we all are. But Stephanie Wu and I both studied the labs to really find out what they're doing. We surveyed practitioners to find out what they like. And it's really reinforces what I think are the true benefits or partnerships that labs represent to the eye care practitioners. They're extending warranties, which is very reassuring, oftentimes 2 to 4 months. They are direct shipping, which is huge. They're going to great efforts to have sterility within the lab. social distancing. Typically, they've had to either furlough or lay off, or just have practitioners, staff members come in part-time.
Right.
But the benefit of that is the staff members are at least 6 feet apart. They use all the hygiene measures. A lot of times they'll have one staff member only handling the packaging. So they've gone to great efforts from a sterility standpoint. They also have really worked hard with each individual practitioner to try to satisfy them and work with them on every patient. And I think that's been a real blessing. And that partnership has been beneficial to practice, beneficial to patient, beneficial to the labs. And it's very evident that those practitioners who do fit special design lenses are the ones that truly are benefiting during this pandemic.
Absolutely, absolutely. It's important, I think, to remember the partnership among patient, practitioner, and the lab in order to keep everybody in the lenses that they need, keep businesses going, and just use labs as a resource. So that's great information. Thanks, Ed. And then my next to last question is, what can ODs do now for their contact lens patients? And then also when they are able to resume regular routine patient care when the office is open?
No, I think that's really important because the offices will reopen. And everybody's concerned about the uncertainty. I live with somebody who has that uncertainty. So, these are factors that are really important. But I think that the practitioners are spending this time a lot in terms of not only communicating with their patients and spending a lot of time doing that, but also preparing for when the doors open again. And much of that is trying to identify what patients we need to see when those doors open, the priorities. And many of the contact lens patients represent a priority. Many of them have been given an extension on their prescription. So they need their primary care examination. We don't want to forget about that. So they're going to prioritize and be communicating with them. And that's going to be important. When they do come back, I assume social distancing. It may be in the waiting room. It may be patients in the parking lot calling and saying, I'm here, and then being welcomed in. It may be, in fact, today when I took our dog for their shots, the vet had it so that you had to hook the leash of the dog onto a hook right outside the office, and they would come out, get the dog, and we won't have leashes for patients that I know of, but we're going to be having a situation where they may be outside and be called in, and that there'll just won't be as many people in the waiting room, and there'll be differences in that regard. But I think also that this will be just a great opportunity for, and the other point I really want to mention is patients really look at perception. And if they see us washing our hands, if they see us wiping down the counters and the slit lamp and everything that we're doing, that is very impressive to them, and they'll feel safer, and it'll be an environment they'll feel more comfortable in.
That's a really, really good point. Yes. Even, and in some cases, if you don't wipe it down in front of the patient in the patient's mind, it didn't happen.
Yeah.
Ed, thanks so much for taking the time to talk with me today. I really appreciate it, and I hope everyone in your family continues to stay well, and we'll be talking soon. Thank you.
Thank you, Gretchen.